We will be discussing cholinesterase inhibitors. This case study will cover myasthenia gravis. The clinical presentation will be a 30-year-old female patient presents with a recent diagnosis of myasthenia gravis, a neuromuscular disorder distinguished by muscle weakness and fatigue. She reports symptoms that include muscle weakness, muscle fatigue, right eye ptosis, and dysphagia. Notably, the patient does not have any comorbid conditions. The primary focus of treatment will be on managing the myasthenia gravis with medication. The medication that we will be prescribing is pyridostigmine, which is prescribed for its symptomatic relief and is commonly used in the treatment of myasthenia gravis. Pyridostigmine is a cholinesterase inhibitor and is the prescribed medication used for the symptomatic treatment of myasthenia gravis. The cholinesterase inhibitors function by inhibiting the breakdown of the acetylcholine, leading to elevated levels of this neurotransmitter. This mechanism enhances cholinergic activity by enabling more acetylcholine to stimulate receptors. Consequently, pyridostigmine aids in increasing acetylcholine levels at the neuromuscular junction, thereby enhancing muscle strength and function. Dosing and considerations. The initial dosing of pyridostigmine recommended for patient entails taking 30 milligrams 3 times daily with meals over a period of 2 to 3 days as per up to date. If well tolerated, the dosage can be gradually increased by 30 milligrams every 2 to 3 days until the desired therapeutic effect is achieved. According to up to date, the maximum dosage typically prescribed is 120 milligrams every 4 hours while awake. However, when managing a patient with CKD stage 3B and their GFR is 35, adjustments in dosing strategies become essential due to pyridostigmine's renal excretion pathway. In cases of renal impairment, cautious dosing is advocated as pyridostigmine's clearance might be compromised. As advised by Hippocrates, initiating therapy with lower doses is important for patients with diminished renal function. Therefore, a tailored dosing regimen starting with lower doses should be carefully considered and implemented in patients with decreased renal function to optimize therapeutic outcomes and minimize potential adverse effects. Cholinesterase inhibitors are the primary class of drugs used for symptomatic treatment of myasthenia gravis. While there are different agents within this class, pyridostigmine is commonly chosen due to its efficacy and tolerability. Pyridostigmine, a medication commonly prescribed for conditions like myasthenia gravis, has several contraindications that healthcare providers must consider before administering it to patients. First, individuals with a known allergy to pyridostigmine or any of its components should avoid its use due to the risk of allergic reactions ranging from mild to severe. Secondly, pyridostigmine is contraindicated in patients with gastrointestinal obstruction, as it can exacerbate the condition by promoting muscular contractions. Similarly, patients with GU tract obstruction should avoid pyridostigmine due to its potential to worsen urinary retention. Additionally, patients with bradycardia, which is an abnormally slow heart rate, should refrain from using pyridostigmine as it can further decrease heart rate, leading to adverse cardiac events. It is crucial for healthcare providers to thoroughly assess patients' medical histories and consider alternative treatment options when these contraindications are present to ensure patient safety and optimal therapeutic outcomes. Adverse effects. Pyridostigmine, a cholinesterase inhibitor, can lead to several side effects, with a cholinergic crisis being a notable concern. Cholinergic crisis occurs due to an excessive accumulation of acetylcholine at the neuromuscular junctions. Symptoms may include severe muscle weakness, respiratory depression, and gastrointestinal disturbances. To counteract the effects of a cholinergic crisis, the antidote given would be atropine. Atropine is a muscarinic antagonist that blocks the action of acetylcholine at the muscarinic receptor, thus alleviating symptoms of a cholinergic crisis. By antagonizing the effects of the excessive acetylcholine, atropine helps restore normal neuromuscular and autonomic function, providing relief from symptoms such as salivation, lacrimation, urinary incontinence, diarrhea, gastrointestinal cramps, and emesis, collectively referred to as sludge. Furthermore, pyridostigmine can also lead to cardiovascular side effects, including bradycardia and hypotension. Increased cholinergic activity can cause bradycardia, which is the slow heart rate, and may lead to inadequate tissue perfusion and symptoms such as dizziness and syncope. Additionally, the cholinesterase inhibitors can increase gastrointestinal motility and secretions by enhancing the effects of the acetylcholine in the digestive tract. This will increase the gastrointestinal activity and may potentially exacerbate symptoms or complications associated with peptic ulcer disease. Bronchoconstriction, another potential side effect, can further exacerbate respiratory distress in vulnerable patients. Management of these side effects may involve supportive measures, dose adjustments, or discontinuation of the pyridostigmine, depending on the severity of symptoms and patient response. Nursing implications. The nursing implications for patients taking pyridostigmine are critical to ensure optimal therapeutic outcomes and minimize potential risks. It is important that patients adhere to the prescribed medication regimen and refrain from abruptly discontinuing pyridostigmine without the healthcare provider guidance. Sudden cessation of the medication can lead to exacerbation of symptoms and potential complications. Emphasis on the importance of taking pyridostigmine as prescribed and encourage open communication with healthcare providers regarding any concerns or adverse effects experienced during treatment. Importance of taking the exact prescribed doses of pyridostigmine at regular intervals to maintain consistent medication levels in the bloodstream. It is essential to adhere to the prescribed dosing schedule and avoid doubling doses if a dose is missed. Educating patients about the significance of adhering to the medication schedule can help prevent fluctuations in symptom control and optimize therapeutic efficacy. Instruct patients to take pyridostigmine approximately 30 minutes before meals to facilitate chewing and swallowing. This timing helps ensure that the medication reaches peak effectiveness when the patient needs it most, improving their ability to manage symptoms associated with conditions such as myasthenia gravis. Clear and concise communication regarding medication administration guidelines empowers patients to actively participate in their treatment regimen and promotes optimal medication adherence and management of symptoms.